a seat. How are you doing today? Okay. I see. Oh, bless you. Okay, so there's quite a few problems that are causing you a little bit of distress. Okay. Well, I'm here today, of course, to try and help that. So we'll get to the bottom of this, okay? Do you mind if I make a few notes? Thank you. Okay. So if you could just, as briefly as possible, try to list some of the symptoms that you're experiencing today. Yeah. Okay. Right. So let me just read them back to you to make sure that we've covered everything. So we've got panic attacks and anxiety. Sore eyes. Yeah. Fatigue and sleep problems. Headaches, and you're also getting a rash on your neck. Alright, great. So we'll work through those and then we'll do a little bit of a debrief. I'll ask you a few questions in the end. But I'd like to first focus on those eyes, headaches and the rash. So we'll do a general health checkup if you don't mind. Okay, have you been feeling generally well in yourself? Or have you been experiencing any colds, flus? You feel okay? Alright, let's have a listen to your chest first. If you could just lift your top up for me, I'll just use my stethoscope to have a little bit of a listen. Alright, so if you could just relax and breathe as normally as you can for me. That's really good. Okay. And when you're ready, take a nice deep breath in and then out. Alright, great. I'm just going to go around the back and listen to your breathing from the back of your chest, okay? So again, just breathe in normally for me. Okay, and a nice deep breath in for me. Good, and again. Okay, that seems all nice and healthy at the moment. You do seem to be nice and relaxed. You're not experiencing any anxiety or feel a panic attack developing at the moment. No? Okay, let me just pop this back. And when you are developing your panic attacks, do you feel that chest tightness, breathing starting to get more rapid? Okay. Right, okay. Let's have a little look at these eyes next, okay? I feel as though the eyes and the headache issue is more than likely connected. Okay. When you're having headaches, whereabouts are you feeling them? Are they more of a frontal headache, sides and temple, around the back. Okay. And does it feel like a hot pain, maybe a dull ache, or does it feel sharp? Okay. I'm going to have a little bit of a press and feel of your scalp, and I just want you to tell me if at any moment you feel any discomfort or pain. Okay. Anything there? No? Okay. About the front here. Okay, and then around this side. No? Alright, let me make a note. Alright, let's have a look at those eyes next. I'm going to be grabbing a torch and I'm just going to be shining the light into your eyes, okay? So making sure for me to not focus on the light but instead look behind me, okay? You do really good. Okay, moving on to the other eye. Okay. Right, next I want you to follow the light for me. So keeping your head nice and straight and just following the light around the room. Okay? Alright, great. How did that feel? Okay. Again, I want you to keep your head nice and still for me. I'm going to wiggle my fingers on either side and I want you to tell me which side is wiggling, okay? Ready? Good. Good. Okay. Good. Okay. That's great. We will just do one peripheral vision test and then I think we're done with the eyesight. Alright. Keep your head still again. I'm going to be bringing my fingers into your line of vision. And I want you to tell me when you can start to see them. Okay? Ready? Good. Good. Great. Good. Good. Okay. Okay, so your eyesight actually seems pretty healthy. Does it feel as though it's more of a fatigue related problem with your eyes? Do they feel sore almost as though they are aching and you're struggling to keep them open? Yeah, because I don't necessarily see any redness. Does it hurt when I gently touch the eyes here? No? I'm looking with the torch again. I didn't see any sort of infection, anything that may be causing eye irritation. There is nothing in the eye that shouldn't be there. Right, okay, so we've combated the eyes, headaches. Let's have a look at that rash for you. Okay, what I'm going to do now is I'm just going to pop some gloves on just because it will protect. If there is any sort of infection, I don't want to get any dirt in it. How long have you had this rash for? Okay, so it's been a few weeks, it's sort of been creeping up. Right. Okay. And is it itchy, hot? No? Okay. Have you changed anything in your diet recently? Okay. Used any different skincare products? No? No changes in routine? Alright, if you just want to pull your neck down slightly, that's it. Okay. Yeah, I can see it looks very, very irritated, doesn't it? And it's sort of travelling now closer down the chest area. Okay. Is this a rash that flares up, or is it one that stays there all the time? It's a flare-up, okay, and it gets quite hot and swollen when it flares. Okay. Right. Okay. I do actually have a suspicion that this rash could be stress related. It does look like it is a natural rash in the body's response to stress, but what I will do is I'll take a sample just to be on the safe side, okay, and we'll get that tested just to make sure that there isn't any infection. Okay, let me go and just grab my little scraper tool. So I'm just going to take this little scraper and just flake off a tiny little bit of the skin that is removing from the rash, okay? Just feels a tiny little scrape here. I hope that's not hurting, is that okay? Okay, I'm just going to grab a piece of cotton wool. Going to place the skin sample under this cotton wool. Okay. And then we'll pop it into the test tube. Be sent off to the lab. Okay, so we'll get this marked and sent off. Okay, but now we're on the topic, I do believe that you are actually okay within yourself, health-wise. I actually believe that a lot of your symptoms do point towards stress. So if you don't mind, I'd like to have a little bit of a conversation with you about your current lifestyle and habits, and maybe see what we can do to alleviate some of this anxiety. Okay. Alright. So, what can you tell me at the moment that may be causing some stress for you? Okay. Absolutely, this is all completely confidential. It's a completely safe space. Right, I see. Okay. Okay. So it seems as though you are definitely dealing with a lot on your plate at the moment. And I definitely believe that, especially the panic attacks, your fatigue, headaches, and the stress rash, definitely points towards you having some stress at the moment. Have you ever spoken to somebody about stress before, or is it something that you have noticed you deal with a lot? Right, okay. And how would you say your general day-to-day lifestyle is? Do you look after your diet and exercise? Okay. And how about, do you feel as though you have someone to talk to? Do you have people around you commonly that you can confide in? Okay. Right, okay. So there are a few different things that we're going to do. I think that definitely work is your biggest stressor at the moment. Would I be correct in that? Okay, so what I'm actually going to do is I'm going to write you a prescription for 2 weeks off of work. So this is mandatory paid sick leave for you. So all you have to do is give the doctor's note to your employer and you'd have those 2 weeks off, okay? Secondly, during those 2 weeks, I am going to I'm going to prescribe you a gym membership and also give you a diet plan. Now this isn't a weight loss diet plan, this is a health maintenance plan, so it will incorporate lots of healthy grains, fruits and vegetables, lean proteins, all the different things that can help you to get the correct amount of vitamins and minerals, etc. Speaking of vitamins and minerals, I'm actually going to prescribe you as well a magnesium supplement. There are big links to magnesium and stress, and with that diet as well, I would like you to seriously consider reducing caffeine and sugar. My reason being that these are both nervous system stimulants, so they can spike your insulin and therefore increase inflammation, which both lead to stress responses in the body. Okay, so if you can try your best to reducing, to 1 cup of coffee a day, really trying to cut down sort of on that caffeine. Yes, and then finally what I can do for you is I can provide you with a stress journal. So the stress journal will ask you whenever you're stressed that day, what was the cause of the stress, how you felt with the stress, and then what you managed to do with that. And it's basically just like a reflective journal, both for you and for me, so that we can accurately see when the stress is occurring, what is the most common reason for the stress, and then how we can work to improve on that, whether we can eliminate the stressor completely, or if alternatively we can create an action plan with those around you to combat the stress the most effectively for you. And speaking of socialisation, can I suggest please that over the next 2 weeks whilst you have sick leave, that this is a time where you spend a lot of time outside in the fresh air, doing sort of calming exercises, so going on nice walks, jogs, bicycle rides, and also making sure that you have a lot of positive social time. So maybe if there are certain people that cause a little bit of heightened stress, maybe distancing yourself from those people in the meantime, focusing on only positive relationships, and seeing if that makes some sort of difference, okay? Alright, so we're going to leave you with those prescriptions. I'll get those ready for you at the pharmacy, and I will make sure that they have the stress journal for you as well, okay? And I'll book you in again for another appointment just before you go back to work to assess how you're feeling and see if you need any extra time off. Okay. Alright, it's been a pleasure, no problem at all. Alright, I'll get those sorted for you. Bye-bye. in. How are you doing? Oh, really? I heard. You've been off school for a few days, haven't you? You've been feeling very poorly. Oh, bless you. Well, it's okay. You've come to see me, haven't you? We're going to make sure that you're feeling better. Okay. Your mummy tells me also that you were at home, and did you have a little bit of a fall? I see. Okay, so you were running round and you'd bumped your head. What was it that you bumped your head on? Okay, my darling. All right, shall we have a little look at that head? Let's have a look at that head first, and then we'll get sorted with your poorliness, okay? All right, you just stay there. I'm just gonna have a little look at the bump here. Oh, bless you. You did hit your head quite hard, didn't you? Dearie me. Okay. Does it hurt when I press it? A little bit? Okay. Alright, well, luckily, I think all we're gonna get is a nice lovely bruise there. You've not managed to cut it, so I think that we're okay. But we're gonna check to see if the bump has made you feel sort of dizzy. Do you feel dizzy at all? Okay. Well, I'm going to do a little test where I look into your eyes, okay? But first, I have a special job for you, if you don't mind. I have a very special friend with me today that I'd like you to keep an eye on, if that's okay. I don't know if you might recognise him. Today I have with me a very hungry caterpillar. Now, this caterpillar came to visit me yesterday, and he's been a very naughty caterpillar. He's been finding his way into everybody's lunch boxes. I know, he must be very, very hungry. So what I want you to do is to keep an eye on him whilst I check your eyes. Is that okay? Great, you take a hold of him there. That's it. Okay, take good care of him. Hold on tight. Great, you're doing such a good job. Okay, my lovely. So, I want to have a little look inside your eyes first. I'm going to be using a torch. It's going to be shining quite a bright light, okay? And I'm just going to have a little look at your eyes. I want you to look behind me. Okay. Stay still. Good job. Good job. Have you had your eyes tested before? Oh, I see. But you must have very good vision. Just a little bit longer. Okay. Good job. Okay. How's that made you feel? You feel okay? That's good. Okay. I'm going to hold my pen out in front of you, and I want you with both eyes to look at the tip of my pen, but keep your head nice and still for me, okay? Alright, I'm going to start moving the pen around. Good, keep those eyes on the tip of my pen. That's it. Good job. Good job. Keep going. Keep going. You're doing so well. Well done. I'm going to bring the pen close to you and back. Keep that head still. Good. And close again. Your eyes might go a bit funny. Good. And back. Okie dokie. You can relax. Good job. I'm just going to make a little note for myself, okay? Just so when I speak to your mummy, she knows what we've been talking about, okay? Just a moment, sweetheart. Great, let's keep going. I want you to now keep that head nice and still again for me. And I'm going to be wiggling my fingers, okay? And I'm going to wiggle my fingers in and out like this. And I want you to tell me when you can't see them wiggling anymore, okay? So they're going to be at the sides of your head where you can't see them anymore. Does that make sense? Good, okay. Keep that head nice and still. Well done, okay. Ready? Good. You can't see them? Well done, okay. Let's do that again. Remember, tell me when you can't see them anymore. Tell me when you can't see them anymore. Well done. Okay, and again. Tell me when you can't see them anymore. Good, okay, let's do that one last time. And tell me when you can't see them anymore. Good job. Okay. Right, I want you to keep that head nice and still for me again, and I want you to focus just on me, okay? And I'm going to be holding up some numbers with my fingers, and I want you to tell me what numbers I'm holding up, okay? But you can't peek, you've got to keep your eyes on my nose. Ready? Okay. 5, very good, okay. 2, well done. 1, yeah. 4, very good. 3, well done. 2, yeah. Keep going. 1, good. 5, okay. 5, very good. Okie dokie, let's take that off. Well done. Okay. Next I want you to, with one finger, keeping your eyes still on me, I want you to bring your finger and touch your nose for me. Good job. Okay. And now I want you to copy me. I want you to keeping eye contact with me. Keep looking at me. Good. I want you to switch to the other finger. Okay? And I want you to keep switching. Keep going. Good. Good. Try and keep up. Well done. Okay, keeping here. I'm going to be popping my finger here. What I want you to do is I want you to touch your nose, then touch my finger, and touch your nose again. So touch, finger, touch. Good, keep going. Back and forth. That's it. Nose, finger, nose, finger, nose, finger, nose, finger, nose. Good. Okay, swap sides. And now nose, finger, nose, finger, nose, finger. Keep going. Good job. Well done. Okay, you can shake those eyes off now. How did that feel? Do you feel okay? You don't feel dizzy? Okay. Right, my lovely. So, you might have given yourself a bit of a nasty bruise, but it seems as though you're doing okay. Now, shall we have a little bit of a check to see what's going on with that cold? Okie dokie. I want to have a look first at listening to your heart and your lungs, okay? So I've got a very special listening device with me that helps me to be able to listen inside your tummy, to listen to your heart and your lungs, okay? So I'm going to be popping this onto your chest. Okay, well done. Just stay still for me. I'm just listening for your heartbeat, okay? Okay, now let's move on to your lungs. Just keep breathing normally. Well done, good job. And now I want you to take a nice deep breath in for me like this. And out. Well done. Let's do that again. Deep breath in. And out. Okay. I'm going to reach round to your back here. And I want you to do the same again. Deep breath in for me. And out. Okay. One more time. Deep breath in. And out. Well done. Nice big breaths. That all sounds really good. Let me write that down so that your mummy knows that you've got a lovely set of lungs. And when you are at school, do you do lots of sports? You do? You like to run around a lot? Good. So we're making sure that we're nice and healthy with our lungs as well. Well done. Okie dokie, my lovely. I'm going to now have a little look at your throat to see if we've got any lumps and bumps. Okay. So you've got a sore throat at the moment. I've got a little mirror here and a little lollipop stick. I want you to stick your tongue out for me and say ah. Good. I'm going to pop this on your tongue and just have a little look inside that mouth of yours. Good job. Has Mummy ever told you that you've had your tonsils out? No? Okay, they might just be hiding. Okie dokie. Okay, I can see a few little white bumps. And it does look a little bit sore. Does it feel sore? I'm just going to be pressing around your neck a little bit, okay? Alright, just let me know if anything hurts. Good job. All feels good. Okay, great. Okie dokie, my lovely. Right, last thing I want to do is just take your temperature, if that's okay. Nothing to be afraid of. We're going to be taking it in 2 separate ways. I want to take one first from your forehead and then in your ear. Ready? We'll do the forehead first. I'm just going to pop this on your forehead like that. Okie dokie. Alright. Next into this ear. Stay nice and still. Good job. And the other ear, just to be sure. Okie dokie. Well done. It's a little bit high, but nothing to worry about, okay? Just write that down. And I'll come and speak to your mummy before you leave, okay? Okie dokie. Alright, so I think you're all fine with your little bump, but please make sure to be a little bit more careful, okay? Especially if we're being off school for being poorly. We need to make sure that we're resting, don't we? Yeah, no running around, okay? Alright, and I'm going to ask your mummy to make sure that you have lots of rest. I want you to stay off school for a few more days just to check that you're getting better. Okay? She can give you some Calpol. Don't worry. I'm going to tell Mummy this as well. You don't have to remember. We're going to give you some Calpol. And make sure that you have lots of lovely ice cream to make sure that we clear that throat. Okay? Alright, my lovely. And you're welcome today to take our caterpillar friend home with you. Okay? Let's bring him out to Mummy and we'll show her. Yeah? Okay. Alright, sweetheart. Let me just reset a little. Yeah, I can hold him for you. You've done such a good job. You've definitely kept an eye on this naughty caterpillar, haven't you? Okay. Shall we go and see Mummy? Come on then, let's go. That's it, this way. Hi, come in, take a seat. How are you doing? Okay. Okay, well, my name is Nurse Sophie. It's lovely to meet you. I believe you're a new patient, aren't you? So we've never met before. Well, it's a pleasure. So when you see a doctor for a longer examination such as this, we like to just save a little bit of time. And you'll be meeting with a nurse such as myself or one of my other colleagues to take some of your vital signs. This is just so we can get patients through with it's good to have these vital signs on file so that we can compare the years to come. Alright, so I'm going to have a little listen to your lungs first, if you don't mind. So if you could lift your top up for me. Thank you. And I believe you're having a full cranial today. You ever had one of those before? No? Okay. They can be quite fun exams. So, if I just pop this on your chest, okay? And just relax, breathe nice and normally for me. That's really good. Okay, if you can just take a deep breath in and out. Okay, let's do that again. Deep breath in and out. Good, okay. Let's do that one more time. Deep breath in and out. Wonderful. Just give me a second. I just need to make a note. I don't actually have my computer on me at the moment. So I'll be noting everything down on paper for now. Great. Okay, next I want to take your heart rate. I've just got this oximeter. I want you to pop this on your finger. It's just going to take your heart rate, okay? Okay, pop that on there. There we go. Okay. And if we just give this a moment, it might take a few seconds just to take your heart rate, okay? Okay, so we're currently at a blood oxygen level of 98%. That's really good, and your heart rate is currently sitting at 84. Okay, let's write that down. Okie dokie. And let's just quickly take your temperature. Stay nice and still for me. Okay. And then we'll take it in the ear as well. Let's start with this ear. Okay. And we could measure this ear as well. Lovely. 37 on the dot. Alright. That's what we like to see. Okay, dokie. Right, I'm just going to take your height and weight. If you could just step on the scales just right next to you. Okay. And then just back up a little. I'm just going to bring this down. Okie doke. So we're 5'7". Okay. Great. Moving on. We'll take your blood pressure now. Have you had your blood pressure taken before? Yep, so you know the drill. If you could just roll your sleeve up. Okay. Just pop this cuff around you here. Okay, that's great. Okay, let's take that off. Just make a note. Blood pressure. We're currently 112 over 82, so nice and healthy. And let's just finish with an ECG. Okay, we had an ECG before? No? Okay, nothing to be worried about. It's nothing scary, you won't feel it. You could just lift your top up and roll your sleeves up, okay? I just have these little electrodes that I'm going to be attaching to you. I'm just going to hook you up to the monitor, and it's going to send a very, very low electrical current. And this just checks that your heart is working nice and efficiently. Okay, so we're just taking these little sticky pads here, and we're going to be popping them on your chest like this. Good. Okay, and then on your arms here as well. Okay, just give me a second to get you wired up. This one, 2, 3, and 4. Okay, right. You haven't got any jewellery on? No, any smartwatches? Okay, wonderful. And okay, wonderful. You can relax now. That's all turned off. Let's unplug you here. And let's just remove these little pads for you. Okay. There we go. Right. I'll just dispose of these. And your ECG results have come back absolutely fine as well. Okay, so that's all your vitals taken with me. If you want to go and wait back in the waiting room, and I'm sure the doctor will call you probably in about 2 or 3 minutes. Okay, pleasure to meet you as well. Alright, bye-bye. Hi, Mr. West, is it? Hello, I'm Dr. Michelle. I'll be conducting your cranial nerve examination today. You've had a cranial nerve exam before? Okay. Well, it's going to be quite an extensive examination. I'm going to be looking at your 12 different nerves. Okay. These will be grouped into different groups depending on where I'm looking. So, for example, we have the ocular nerve, which is taking care of our eyes. We also have the olfactory nerve, which is our sense of smell, our cochlear nerve, hearing. Does that make sense? Wonderful. Okay, I'm going to be referring to my notes throughout, if you don't mind. just so I can make sure that we're quite extensive and thorough with the examination. I want to make sure that I don't miss anything off, okay? Wonderful. Alright, so I believe that you're having this cranial nerve because you had quite a significant head trauma, is that correct? Okey-dokey. And I know that you mentioned to our receptionist as well that you're concerned that you may have asthma. Right, okay. That's something I can quickly determine now, if you don't mind. I just have this big flowmeter, okay? And all I need you to do, it's thoroughly sterilised. All I need you to do is have a nice hard blow on it, and we'll have a look at your lung capacity, okay? So, blow. Good, okay. You're absolutely fine. You may feel sometimes that you are experiencing asthma-like symptoms due to low cardiovascular health, so what I would definitely suggest is increasing that cardiovascular activity, so going out for walks or maybe some cardio exercise, so treadmill, cross trainer, maybe going dancing, things like that. Alright, anything to get your heart rate up. Okay, right, so we're going to begin with the optic nerve. This is going to be quite simple in the sense of it's going to be very simple, like you're going to the opticians. Alright, great, so we begin first. I'm going to be using my light here and I'm going to be shining it in your eyes, okay? Okie dokie, stay nice and still for me. Are you experiencing any specific head trauma symptoms, feeling dizziness, tiredness, headaches, lack of concentration? Okay, I'm just going to switch between the eyes now. Any problems with our vision that we're experiencing? No? Okay, that's great. So, I'm going to also be looking at your overall facial symmetry, especially your ocular symmetry. So I'm just going to be preparing my hands here because I'm going to be most likely touching your face throughout the examination. So I'm just going to take an antibacterial wipe. Okay, lovely. So let me just have a look at you. I'm going to be assessing how symmetrical your eyes are as well as the rest of your face as well. This is helping me to determine whether or not you've experienced any stroke symptoms due to the trauma. Okay, I'm happy with that. Let me just make a quick note. Okay, next I want you to keep your head nice and still for me, and using just your eyes, I want you to follow my finger as it travels across the room. Alright, ready? Okay, let's do the same again. We're covering one eye. Okay, keeping the head nice and still again. Okay, and then covering the other eye instead. Ready? Okay, great. Next, we're going to be doing similar tests. Okay, where I'm going to ask you again to keep your head nice and still. I'm going to be placing my finger in front of my face here, and I want you to focus your eyes on my finger, and then look at my nose, and then look at the wall behind me. Okay, wonderful. Back at my finger, and at the wall, and at my nose. Back at the wall, back at my finger, at the wall, at my finger, at my nose, and at my finger. Great. I just want you to follow my finger, keeping your head still again. Good. Keep following. Good. Okay, dokie. Okay, next we'll be assessing your peripheral vision. So again, pretty similar. Okay. So, keeping your head nice and still again, I'm going to be using my fingers to bring them in to your field of vision, and I want you to tell me when you can see them. Alright? Good. Head nice and still. Very good, okay. Good. Good. Great. Okay. And let's do that with covering one eye. Okay, same again. Head nice and still. Good. That's it. Just keep focusing on one point. Good. Good. Okay, great. And then I'll switch into the other eye. Okay, ready? Good. Good. Great. Okie dokie. Alright, so it seems as though your ocular nerve is working efficiently. Let's move on to your facial nerve. So we're going to be assessing the symmetry further. I'm going to be assessing some of the facial muscles and making sure that they're feeling as they should do. also making sure that you can feel the sensation. We're also going to be doing some facial expressions to make sure that you can use the muscle groups as they're intended to be used, and then we're going to finish with the muscle strength. So I'm going to be asking you to lock your jaw. I'm going to be using some force. Okay, great. So let's start with the facial muscles. I'm going to give you a few facial expressions to pull, and I want you to just pull them when I tell you to. Okay, so first, if you could pull out your cheeks for me. Okay, I'm just going to have a feel. Just palpating the muscles as you're using them around the jaw and the cheeks. Okay, relax. Good, and then a big, nice smile. Good, hold that. Lovely. Okay, and could you frown for me? Okay, and then stick out your tongue. Move your tongue to this side, that side, up to the roof of your mouth, and down again. Okie dokie, and could you pull a sad face? And finally, open your mouth as big as you can. And then make it as small as you can. Great. Okay. Okay, next we're going to be assessing the muscle strength. So I'm going to be asking you to push against my hands. So I'm going to place my hand here and I want you to try and push down. Good. And then next on this side, try to push my hand. Good. This side, push. Okay. And then keep your head up, keep your head up. Good, okay. While we're here, we'll do some hand assessments of strength and muscle as well. So if you could squeeze my hands as tight as you can. Good. And now I want you to push. Push, 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 push. Good. And in between, I want you to push. Good. And then don't let me close your hands. Push, push, push. Good. And shoulders, lift them as high as you can. Good. Okie dokie. That's great. Okay, we'll move on to touch, sensation and symmetry. I'm going to be having a little look at your face now and just assessing the overall symmetry, okay? So just stay nice and still. This will just take a little minute. Just going to be having a look. Okay, just keep your face nice and relaxed. Turn this way and that way. Okay. Great. Finally, I want you to close your eyes for me, and I'm going to gently press on your face, and I want you to tell me where it is that I'm touching. Okay? Okay. Close those eyes for me. Good. 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 Okay. Great. happy with that assessment. We'll quickly move on to your sense of taste, seeing as this is a quite quick one. Have you noticed any changes in your sense of taste? Okay, great. And I'm going to do a quick gag reflex test. I hope you don't mind. This is the worst part of the examination. Just take a nice clean tool here. Okay, so nice clean lollipop stick. If you could stick your tongue out and open your mouth. Good. And okay, let's try that again. Great. Okie doke. And just keep that mouth open for me. I'm just going to have a nice little look. Just to look at the symmetry inside your mouth. And we forget quite commonly that the tongue is also a muscle that can lose its symmetry when trauma is applied. Okay, I'm happy with that. Wonderful. Okay, right, we'll move on to your olfactory nerve. So I'm going to be testing your sense of smell. Okay, I have these little vials here, all non-labelled, so you'll be able to know what scent is in them. And I'm just going to simply waft them in front of your nose. I want you to tell me what you can smell. Okay. Okay, first one. What can you smell? Lemon, very good. Okay, great. Next. Ready? Okay. What can you smell? Grass? Very good. Okay. Just two more. Okay, next one. Okay. What can you smell? Cherry. Very good. Okay. And let's grab the last one here. Okay. What does that smell like? Peppermint. Very good. Great. Nice, quick and easy one. Let's just make a note. You pass that one with flying colours. Okay, and our final is our cochlear nerve. So we are going to be doing a number of hearing assessments. Okay, have you ever had a hearing test before? Right. So I'm going to be doing 3 separate tests. One to do with word understanding. So I'm going to be whispering a few different words from ear to ear, and I want you to relay that to me. Okay. Next is distance sound. So I'm going to be making a flutter sound like this, and it's going to get further away. And I want you to tell me when you can stop hearing it. I'm also going to be making this sound again, to right, so that you can assess which direction sound is coming from. And then finally we have this tuning fork, and I'm going to be doing similar tests assisting with that, so directional and distance. Okay, wonderful. So we're going to begin with the word interpretation, okay? I'm going to begin with this ear here, and I'm just going to go into a whisper here. I'm going to be whispering different words, okay? Alright, and just repeat them back to me. Ready? Fox. Okay. Candle. Good. Garden. Very good. T-shirt. Okay. Temperature. Okay. Apple. Good. Bird. Okay. And chest. Okay, very good. I'm going to be moving on to the other ear now. Okay, and a whisper again. Feather. Okay. Disc. Good. Pin. Good. Pillow. Good. Flower. Good. River. Okay. Desk. Good. Flight. Good. Cloud. Good. Okay, very good. You just make a note. We're flying through these. Okay, let's move on to our distance. So this is perfectly okay for you to keep your eyes open for now. I'm going to be making this flutter noise. And I want you to just simply tell me when you can't hear it anymore. Okay, ready? Good. Okay, and again. Good. One more time. Very good. Okay. Okay. Now I want you to close your eyes. I'm making that sound from ear to ear, and I want you to tell me whether it is your right or your left that you can hear the noise. Ready? Okay. Good. 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 Okay. Good. Okay. Okay. Very good. Alright. Okay. And finally we're going to be moving on to the tuning fork, okay? So I want you to close your eyes for me. Okay? Good. And I'm going to be playing the tuning fork, and I want you to tell me when you can no longer hear the sound. Alright. Very good. Okay, and again. Very good. Okay, I am satisfied with all of those tests. Now, I know you were referred by accident and emergency department to come for the cranial nerve due to head trauma. I am satisfied to say that you have passed that, so I'm not concerned that the head trauma has had any lasting effect. However, I would suggest that you definitely keep an eye on yourself. Please take a lot of rest and maybe give yourself 1 to 2 weeks of pure rest off of work as well, okay? Just because we don't want to exacerbate anything. If you are feeling any pain, please take paracetamol, but don't take ibuprofen just because that can reduce any swelling. And if there is swelling present, we want to know about it, okay? And otherwise, you can report to reception and book in for your next appointment. Alright? Thank you. Bye-bye now. Hello. Thank you for letting me in. Do you mind if I just take my jacket off? It's horrible weather outside, isn't it? Absolutely chucking it down with rain. Just thought I'd take my jacket off just because it's a little bit wet. Right, my lovely. So, how are we doing? Right, it's my understanding that you were feeling a little bit under the weather, right? Yeah. Okay, so you were calling the GP, right? You've been in contact with your GP, but you weren't able to attend an appointment? Okay, was there a reason for that? You just felt like you weren't able to make your own way in? Alright, lovely. Well, I'm Dr. Michelle. Sorry, I should have introduced myself sooner. I am the community GP, so when you see those little doctor's cars, that's us. And basically the GPs have asked me to come and visit you today and do an at-home assessment, if that's alright. Right, okay. I see, so you called 111 for some chest pain. Okay. Alright, did you not want to go off to A&E? Right, okay. Okay. So the chest pain's actually some anxiety because you've not been feeling too well. Dizzy. Alright, no problem. Well, I've got my little bag of tricks here with me. I'm just going to check to make sure I've got everything with me. We travel around so much that I always end up forgetting something. But I think we've got everything with us here today. Okay, so we're assessing for some dizziness and some chest pain overall, just generally feeling unwell. Alright, I do have to let you know if we do find there is an issue with your chest pain, I am going to have to take you over to A&E for further assessments and bloods, okay? I can't do that with you right now, but I can have a checkup with you, okay? Alright, so when did this start? Right, okay. So you've been feeling a bit unwell for a few days now. And you're starting to struggle to get around. So if you were to get to the GP, it would be a difficult task for you. Okay. Just let me grab my stethoscope here, it's a bit tangled. Right, lovely. Before we begin, I'm gonna just prep my hands as well. I brought myself some hand sanitizer. Okay. some gloves on as well. Just to keep you nice and safe. Okay. So have you got anyone that you could maybe call if you're not feeling well? A family member or a friend? Okay. Right. Okay. So maybe if you were needing to go for a GP appointment, it might be helpful if they could maybe give you a drive-in. Only if they can, obviously. We're always happy to come and have a look at you. I think all the medical services are starting to change up a little bit, aren't they? You can now get your optician's appointments straight from home. You don't have to go in for it. And I understand with the weather as well, of course. You wouldn't want to be going out in the rain, would you? No, I understand that, my love. Right, okay. If I could just have a quick look over you as well. So, you've been saying that you've been feeling really dizzy, right? Mm-hmm. And you haven't had any accidents recently? Fallen over, bumped your head? No, not that you can remember anyway. Oh, I'm exactly the same. So clumsy. I'll find a new bruise on me and think, oh, where did that come from? Because I'm just always walking into things, eh? Okay. Just having a look through your hair as well, just to make sure we're not missing anything, okay? Alright, well, it looks good, I believe you. I don't see any head traumas. So, if you could just lift your top up for me, and I'm just going to have a little listen to your heart, okay? Okay. When you've been having chest pains, where is it that you've been feeling those chest pains? Right, okay, so it's been more in your throat. That definitely does sign up with anxiety. Have you been feeling anxious in yourself recently? Okay, and what could maybe have brought that on? Right, okay. So there's been quite a lot of life changes recently. But that can stress out just the best of us, can't it, hey? Okay, because your heart's sounding lovely and regular. Of course I can do an ECG for you as well. I'd have to take you down to A&E in order to do that, okay? So let's have a listen to your lungs as well now, okay? How's your breathing been? Okay, let's have a listen. You just breathe normally for me. Okay, then just take a deep breath in and out. Okay, very good. And again, deep breath in and out. Alright, lovely. I'm just going to reach around the back of you, okay? Okay, I'm just going to listen to your lungs from behind, through your back now. Just breathe nice and normally for me. You're doing a really good job, that's it. take a deep breath in for me again. And out. In. And out. Okay, yeah, so breathing sounding nice and normal. I'm not hearing any fluid on the lungs or anything like that. Nothing concerning. Have you been feeling generally under the weather? Have you been getting sore throats, colds, things like that? Or is it just dizziness and chest pain? Alright. How long have you been feeling under the weather? Okay, so it's been a good few weeks now and it doesn't seem to be getting any better now. Okay, and have you been taking any medication for that? Right, okay, my lovely. Let's have a look at you then. I'm going to have a look inside of your throat as well. Okay, let's see if we can find a reason for that sickness. Have you been to a pharmacy at all? No. So am I the first port of call for you? Okay. If you just open your mouth, I'm going to pop this onto your tongue and just have a look inside, okay? You're doing a great job. Wide as you can, that's it. Okay. Could you say ah? Could you say ah? Alright. I don't see anything on the back of that throat. I'm just going to have a little feel of your glands if you don't mind. So just keep your neck nice and relaxed for me. I'm just going to palpate down here. You just tell me if it hurts at all, okay? No pain now? Okay, that's great. Right, so we'll go on again with the torch, and this time I want to have a look inside your eyes, okay? Just make sure it's actually turning on. Why are we not turning on? Oh, there we go. Okay, so I'm just going to have a look into your eyes, okay, and see if any of the dizziness is related to any sort of vision issues, okay? So, if you could just have a look behind me, and I'm just going to use the torch to check your pupil dilation first, okay? So you just stay nice and still, try your best not to focus on the light. Gonna be bringing the light gently in and out, just like this, okay? Okay, right, and then the other eye. Good job, keep going. Okay, alright. There seems to be a little bit of labouring, laziness within the dilation. It doesn't seem to be acting as quickly and efficiently as it should do. Do you wear glasses at all? Just for reading? Okay. Okay. Right, we'll do some further tests on your eyesight now, okay? Just because I'm a little bit concerned towards your vision. So I'm going to test your periphery next, okay? So I want you to stare at my nose and I'm going to bring my hands into your vision and I want you to tell me when you can see them. Alright. Okay, whenever you're ready. Okay, good. Okay. Okay, let's do that one more time. Okay. Alright. Good. Alright, my lovely. Let me just have a little look at your eyes here. I'm just going to apply a little bit of pressure around the lids, okay? Just tell me if anything hurts at all. Are you feeling any sort of pain or pressure? Okay, I'm just going to move up to the forehead. I'm just going to press on your forehead here. Okay. Okay. How about here? So you're feeling quite a lot of pressure in the temple. Yeah. Okay. I'm just going to take your temperature, my lovely. Okay, just stay nice and still. Right, okay. And just check again in the ears. And the other ear, just for good measure. Okay, yeah, you are reading as though you've got a little bit of a temperature, so I am going to take you over to A&E. I'm just going to do a few further checks on you just to make sure that my assessment's right and to get all the information that I need to be able to relate to the doctors at the hospital. Okay, so let's carry on with that eye assessment. If you could keep your head nice and still and just with your eyes just follow my finger. That's it. Good job. Keep it going. Okay, let's just close this eye and just do it with your left eye now. Okay, and uncover this one. Doing such a good job. Alright, sweetheart, so although your breathing is okay, your eyesight does seem to be quite laboured, and with that temperature as well, there is quite a cause for concern. I'm just going to take your heart rate with my pulse oximeter, so could you just pop this on your finger now? We'll just take a look at your heartbeat. This will take your blood oxygen levels as well. Okay, and then I'm just going to do your blood pressure to finish. Alright. Okay. Yep, so your heart rate is a little bit elevated. Do you commonly take your heart rate, and do you know what's usual, regular for your resting? Right, okay. So it would be more around 65, 70. We're currently sat at 89. Your blood oxygen's looking good at 95. But let's just, for good measure, take our blood pressure before we head off. Just to save the doctors some time when we get there. and then they can get you right in to do an ECG and some bloods, okay? So let's just pop this cuff on. That's it. Okay. Ready? Just relax that arm nicely for me. Okay, let's take that off. Alright, so blood pressure's sitting very high here. We've got 145 over 90. So we are going to take you down now, alright, my lovely. So as I said, we'll get some bloods and ECGs. Just make sure I've got all my equipment with me. We'll get some bloods and ECGs for you. And then they might want to do some further assessments based on their findings, okay? Oh, it's not a problem. Yeah, well, all of us have some days where we're not feeling so great, okay? So it's a good thing that you called 111. Yeah. And yeah, let's get you down to A&E. Okay. Have you got a jacket that you'd like me to grab for you? It's really, really raining outside. Your umbrella? Alright, I'll go and find that. Just let me pop my coat back on. Okay, I'm going to pop straight into my car and I'll take you straight down, okay? We have got a blue light as well, but it's not an emergency to put the lights on. Alright, right, I'll go and find your umbrella. You just sit tight, okay? Not to worry, it won't be a moment. Come on in and take a seat. How are you doing today? Right. I believe that you're coming to visit me today because you've had some problems with your hearing, is that right? How long have these problems been going on for? Quite a while, I see. Right, okay. So we're going to be performing quite an extensive ear cleaning today, aren't we? Great. Okay. I just want to take a little bit of info before we begin, and then I'm going to do a very quick hearing exam on you, just so I can see to what extent the damage your hearing is undertaking at the moment. Do you know if you have any previous history of eardrum damage, or is it just that we're struggling with the build-up of wax? Okay, so it's a common occurrence that you're sort of overproducing. No problem. Okay, so could I just take your first and last name just to confirm the appointment? Okay, and your date of birth for me. Great. And you say that this problem's been going on for about 3 or 4 years. Okay, and have you had a cleaning before? When was the last cleaning? Okay, and was that with us? Great. Okay, if there is anything else that you would like us to have a check over today, if you've noticed any changes in maybe the quality of the earwax that you've been experiencing, or if there's anything externally to the outer ear that you've been concerned about. Right, okay. So there's been a lump on this ear at the back, right, okay, and it's just been persistent. Okay, has anybody had a look at it before? Okay, well, what I'll do is I'll just have a look for that lump first before we begin the hearing assessment. just so I can be certain that we don't need to do any sort of skin graft. Nothing to worry about, but we like to be quite thorough, don't we? So I'm just going to prep my hands and make sure that they're nice and clean, so that I don't cause any further infection if there is one. Okay, just let that dry for a moment. I'm going to be using antibacterial gel and also gloves just to add a double layer of protection for you and your skin, okay? The skin can be very, very sensitive, and especially if you're experiencing a problem and an issue already, we don't want to be adding any extra bacteria to that area. Okay, so let me just pop my gloves on. It's a very hot day today, so it's probably not going to be too easy for me to pop these on. I do apologise. I've noticed that every time it does become a little bit warmer, these gloves are just not playing ball. We've been recently buying the non-powdered ones, and it definitely makes a huge difference to have the powdered ones, so maybe we'll buy those ones next time. I think there was a stock shortage this time when there was an order put in. There we go, that one wasn't so bad. Alright, my lovely, if you just sit still, I'm just going to come round here and have a look at this ear for you then, okay? Just tell me if it's hurting. So is this what we're talking about here, this little lump? Yeah. Okay, I'm going to press on it here. Is it painful? Just uncomfortable? Okay. Alright, I'm just going to take a little tool that I've got here. It has a little torch on the end and it's almost like a magnifying glass, okay? And I'm just going to look up at the screen behind you and I'm just going to see if I can see the surface of the skin area in a little bit closer detail here. You're doing so well. Okay. Alright, so there is no difference in pigmentation. So that's a really good sign. Let me just make a note for you, but I would suggest you go and see a dermatologist about this. As I said, there's no change in pigmentation. You know, there is no sort of evidence that there would be any sort of mole or anything like that with the lump. It does look to me as though it is a cyst, so it would probably be most comfortable for you to get this removed, especially if it's causing you pain and irritation when you're sleeping on that side. Yeah, okay. So what I'm going to do is, if I refer you to our in-house dermatologist, and she'll get in contact with you about having another check on that. Obviously, you know, I can have a look as much as I like, but I'm not an expert, so she'll be able to identify definitely for you if it is a cyst, and then hopefully get it removed for you. Okay. Alright, so let's move on to our little hearing test. We're just going to do a few little games, okay? So, firstly, I want you to close your eyes for me, and I'm going to flutter my fingers on either side of your head like this, okay? And I want you to tell me which side you hear it on. Alright, so close those eyes for me. Very good. Okay. Good. Good. Okay. Good. Good. That was a trick one, both good. That's great. Okie dokie. So directionally you're able to still tell where sound is coming from. Next we're going to do the same thing. I've flutter my hands and I'm going to gently move them away, and I want you to tell me when you can no longer hear them, okay? Okay, so close your eyes again and tell me when you can no longer hear. Good, okay. Okay. Good job. Okie dokie. Okay, right, and let's do that again, but this time I'm gonna slowly bring the sound back in and I want you to tell me when you can hear the sound. Okay, close your eyes again. Ready? Okay. Okay, good. Good. Great. Okay. Next, I am going to be whispering a few different words into either side of your ears, and I want you to simply repeat the words back to me. Okay? So we're going to be assessing how clearly and coherently you can hear. Okay. Book. Very good. Dress. Wire. Very good. Strawberry. Strawberry. Good. Slipper. Good. Micro. Very good. Jewel. Good. Crisp. Good. Floral. Chopstick. Lemon. Good. Red. Good. Blanket. Good. Rustle. Good. Hanger. Good. Scissors. Good. Zest. Good. And last one, basket. Great, okay. You were relatively coherent with those. There were a few that you maybe misheard a little bit, but they were within the generalised area of words. But you're definitely going to need clearing, aren't you? Hopefully it will help you hear a little bit better. So I'm going to start ear by ear. We're going to start initially with a just gentle assessment of how much we're needing to clear. I'm going to be taking my torch here. Okay, and we'll start off with this ear again. I'm just going to be taking my torch and having a look inside, alright? So if you stay nice and still for me. That's great. Just with my other hand, I'm going to be sort of moving the ear around a little. Just like this, that's it. Just making sure that I'm not missing any areas. Okay, and the other ear for me. Stay nice and still. Nothing's hurting now. No issues here. Okay, so I've had a look inside the ear and there is definitely a lot of wax built up. So what I suggest our plan of action is that I first go in with a scraping tool to try and remove as much internally as I can, and then we will add the solution to drain the ear at the end. Is that okay? Alright, so let me just move my tools a little here. Okay. So I'm going to first start with an alcohol wipe, just to make sure that the ear surface area is nice and sterile itself, okay? Okay, so I'm just going to a good wipe down of the external ear. Okay, let's get a nice clean wipe for the second ear. Again, just stay nice and still. Okay. Looks great. Alright. So, this will be the tray that I'm going to be draining the ear with. So, what I'm going to do is I'm going to drop some solution into your ear and hold the tray underneath. It will also use this to collect any of the wax that I remove by scraping first, okay? So let me just grab my scraping tool again. Okay, so I'll just pop this on my knee, and I have my little magnifying glass here, and I'm going to be using that so I can see quite nicely into the ear, okay? So stay nice and still for me. to the other ear. Now we can finish with the solution. So it is a simple liquid solution, but it's going to sort of fizz a little bit in your ear. It may sound a little bit strange at first, okay? But it's just going to take 10 seconds or so to sort of fizz and loosen up before it starts to drain. Okay, so just tilt your head ever so slightly for me and drop it into one side first. Okay, stay nice and still. Good job. You feel that fizzing? Okay. Just give it a second. I'm going to pop this underneath your ear here, alright? Just tip your head. You should feel it start to drip out. Okay, and now tilting your head the opposite way, I'm going to drop the solution into the other ear. Okay. Good. Okay, popping that underneath your ear here and tilting this way now. Coming out really nicely. Okay, great job. Right, so your ears are looking a little bit red and irritated now, so what I would suggest is that we leave that in here for today. You come back maybe 2 or 3 weeks time and we'll do the same process, repeat the same process again. Just because I feel as though your ears are incredibly sensitive and I don't want to upset them too much. Okay, I think we're probably better doing small and regular appointments as opposed to long and extensive cleanings. Okay. And of course, aftercare wise, please remember, do not use any Q-tips, cotton buds in your ears, okay? All that's doing is pushing that wax further in. I know it can feel quite relieving, but long term we're just doing more harm than good, okay? Alright, great job. Steamy baths and showers can also be really helpful for loosening that wax and helping it to loosen as well. Alright, okay, so we are all done for today. It's been a pleasure meeting you. I will get that note over to the dermatologist to get you referred, and otherwise I will try and contact you to make an appointment in about 3 weeks with me. Alright, no problem. Thank you so much for coming in. I hope you feel a little bit relieved. Thank you so much for coming and visiting me today. Welcome. Have you ever visited us before? Okay. I thought you were a new face. Have you ever seen a reflexologist before? Experienced any reflexology, whether by a professional or if you've tried it yourself? Okay. Well, reflexology is using the mapping of body parts to link towards different areas, problem areas in our body. So we can use pressure, targeted pressure on these different points in order to relieve some of the pain that we're experiencing in organs, for example, that we may not be able to target directly through pain relief normally. Okay, so today I'm going to be marrying the reflexology with an overall assessment of yourself as well. We're going to be doing an assessment to see where you may need a little bit of reflexology, what parts of your body you're struggling with at the moment, and how generally your body is moving and responding. Okay? Wonderful. So I'm first going to begin by taking a little bit of information from you. I have a few questions I would like to ask. Okay? Let me just... Okay, so when was it that you last tried reflexology? Okay, and was this by yourself? Okay, and when you tried it, was it maybe a type of tool or aid that you were using, or was it an attempt to map out pressure points yourself? I see, okay. So you've actually been using the aeroplane pressure points. So the aeroplane bands. Do you suffer with nausea quite a lot? Okay. And is that due to travel sickness, or is that generally sort of any motion? Okay. Okay. If I could just ask you generally, how are you feeling today? If you could scale it from 1 to 10. Okay. Anything in particular that you'd like me to check? Okay, so stomach tenderness. Right, possible. Okay, that's fine. And migraine. Okay, so for stomach tenderness, you're saying that you've been commonly getting urine infections as well. We'll be definitely focusing on reflexology for the organs obtained in the abdomen. I'm going to do a pressure test with you to try and discover where that pain is targeted in particular. And then you've been experiencing migraines as well. Okay, would those migraines be due to maybe excessive screen use? Okay, do you wear glasses? And when are those migraines coming on? Okay. You're getting a good diet, lots of water. And finally, how would you assess your mobility at the moment? Okay. Well, I'll have a little look at your muscles and reflexes as well. Alright, pop this down. So, I'll do a quick assessment on you first, if you don't mind, just so I can have a look at where we're wanting to target, okay? So, I first want to have a look at your scalp and your forehead. I'm going to be popping on some gloves. And just like with your abdomen in a moment, I'm going to be palpating a little on the skin. I'm going to be doing various levels of pressure, and I want you to tell me if you're feeling pain. Okay. Have you tried any different forms of holistic pain relief? Okay. Okay, so you're really into holistic healing. I see. It's very interesting. We do tend to have quite a few of our patients come in that are relatively interested with mind and body balance, grounding to the earth and its elements, things like that. It's very interesting how the two sort of correspond. Okay, if you could just stay still, I'm gonna have a look. Your scalp first. Just gonna be palpating just like this, okay? You let me know at any point if it becomes too painful. Coming around the back of the neck here. Around the jaw. Under the chin. And down the lymph nodes. The neck. And then just up on the forehead here as well. Down just on your temples here. Down the jaw. Okay. Okay, just make a note. So you were having specific pain in the temples and also right in the back of the neck. Right top of the spine. This may be due to a lot of screen time, having the neck flexed in a way that is not natural. We're putting a lot of tension on that upper spine. This can lead to permanent and significant damage if not taken care of correctly. Okay. Right. with that, I just want to have a little look at your alignment, if you don't mind. Okay, I'm not going to be doing it from the front. If we're having some spinal issue, I just want to see if the shoulders, the chest and the neck are nicely aligned and proportionate. Okay, so I'm going to be taking my tape measure here, and I just want you to stay nice and still for me, okay? Okay, just maybe measuring to myself a little. Okay. Okay, keep that head nice and still and up straight. Okay, I'm going to go from the ear down. Okay, just relax those shoulders for me. Okay, let me just have a little feel here. Can you try and push against me? Push against my hands. Okay, and if I bring my hands behind you, try and lean back. Okay. And if I try to push your shoulders down, try to shrug them upwards. There is definitely a lacking on your right side. Have you noticed any shoulder weakness on that side? You sometimes get a little, yeah. Does it feel more like a knot, or does it feel like a muscle strain? A knot. Okay. Right. That's fine. Just for good measure, I'm just going to do some angle measuring as well. Okay, let's take it down. Okay. Just measuring the depth and the angle of your collarbone. Okay. That one's come back more. Okay, right. We're going to move on to your abdomen now. I'm just going to be palpating the abdomen. Alright, so just stay nice and still. This may take a little while. I'm going to be quite thorough. Just tell me if you're feeling any significant pain, okay? Just come a little bit closer to you here. Okay. Any pain yet? Okay. I'm going to be sort of massaging quite deeply into the stomach area here. Okay. Right here. Okay, right. It seems as though you've definitely got some kidney issue. Okay. I know. Okay. Alright, let me just remove my gloves. Okay, so I'm going to discuss with you a little bit about reflexology. Okay, so I'm just going to show you my chart here. This is going to help to explain to you specifically where we're going to be targeting today. Okay, just the complexities of the reflexology mapping is very interesting. So there are different ways of targeting reflexology. We have most predominantly the hands and the feet. We also have the ear, and there are reflex pressure points that you can use on the face as well. Okay. Today we're going to be focusing on the hand. So we have the palm hand, the lateral, the dorsal hand, and the medial hand. So that would be the back of the hand and the area on the side of the thumb. Okay, so I'm going to be performing that on yourself today, but I will just explain to you which pressure points I'm going to be targeting first. And for targeting pressure points, we have the reflexology pen, which is a special pen that I can apply pressure to, but it springs back, so I can apply hard pressure to leave a mark, if you can see those there, but not so much to where it's going to pierce any skin or be painful at all. You should just feel a nice relieving pressure. Okay, so I'm going to start with the palm hand. You can see that they're divided into a lot of different areas. So for yourself, for example, we're definitely going to be targeting the area for the kidney. So you can see this, for example, on the left palm hand here, and then the right palm hand here. We also have the bladder, which can be found on the thumb right here, and on the other side, the bladder right here. We also have the intestines, pancreas, the stomach, and the diaphragm, as well as the gallbladder, liver, and spleen. So those are all areas we're going to be targeting. Okay. So you can see, for example, the kidney area is quite large on these two places. Whereas, for example, all of the intestines and bladder are located sort of in the same large area. So there are areas such as this which target one specific organ, and then areas like this which can be used to target a lot of different areas. The same with, for example, we want the top of the shoulder and the spine. So for example, we have the top of the shoulder here. And then we have moving up to the head and brain here. So we would be targeting all of this finger pressure point area. Okay, wonderful. So if you'd like to get yourself comfortable, and we'll move on to applying the pressure points onto the hand. Okay? Great. Okay, so if you just relax your hand for me. That's it, very good. Okay. Alright. So we have the kidney here. Good. Okay. Moving down here to the bladder. And then the liver, right here. Okay, and then the top of the shoulder, right on this line here. Changing my tool now. I'm going to be taking a tool that doesn't compress, and I'm just going to be running the pressure down here. Just like that, very good, okay. Okay, moving on now to the lateral hand here. So we're working with this side of the hand. So first the kidney again, which is located and the sinus and neck down here. I'm going to be taking this tool again, just running my hand up and down the finger like that. Moving on now to the dorsal hand, so the whole flat edge of the hand here, moving back to my pressure point. We're again focusing on here, this area, and here. Okay? So retargeting that kidney. This area is generally located for the stomach and pancreas as well. And then we also have the bladder right here. Alright, how are we doing? Was that okay? It can be quite a lot of pressure, but I hope it wasn't too uncomfortable. Okay, well, we're going to see how you get on with that. Please let us know if you're feeling any of the benefits. You can also apply pressures in these areas to yourself. You can use something like this, which has a pressure point, or alternatively, you can simply use your fingers to press on the areas, but just be mindful. Okay. Alright. Would you like to book your next session as well? Okay. Let me just grab up my phone. See my calendar here. Okay. So I have availability in 2 weeks' time, the 8th of September, and does 3:30 p.m. work for you? Wonderful. Let me just pop that in. Great, all saved for you. And let me know how you get on, and otherwise I shall see you then. Alright.